What excites me about this position is that I get to work with rural populations throughout the mountain region, and I get to learn about their specific health needs that are going to be varied and diverse throughout the region. And I'm excited to work on community engagement on issues of health, which I am very passionate about. I'm a medical anthropologist who has spent the last 20 years doing research, teaching, and community engagement on health issues. I've primarily worked on health disparities, reproductive health, disability, emergency medicine, and the issues I'm most interested in lately are issues of trust in healthcare. My background is having worked on community health programs in India and Nepal, health research in Guatemala, health research in Oregon, and also California. So my personal and professional goals for this position are to really learn more about the specific health needs in the rural mountain areas of Colorado and to really help build collaborative, inclusive programs that are really reflective of what's needed in the community. The community health needs that I hope to address, I anticipate being centered around issues of access and disparities. So what are the reasons why people aren't able to access healthcare? And of course, this can entail a number of structural reasons. Specifically, I see issues of mental health, aging populations, addiction. There's plenty of sort of specific health topics that I could see would be very relevant in the communities I'm working with diverse communities, working with the Latino populations. And also, I think one of the key issues that shapes a lot of rural healthcare is trust and why people do or do not trust their healthcare providers or the system, issues of insurance and other kind of structural reasons that might shape how people make their healthcare decision making. I think collaboration is pretty essential to solving difficult challenges. I think people have unique points of view and they need to feel heard. And so the whole process of bringing people together and collaborating and sort of, hashing out ideas and strategies and vision is a way to create programs that are inclusive and transparent and really reflect the needs of the community. And in terms of how I fostered that in my own background, for sure, when I was working in India and Nepal, I was working with local nonprofits, NGOs, health advocates, people in the medical realm, like the chief medical officer or people at the hospital. And so you're getting input from multiple people in the community about what's really happening, on health issues. And you strategize together, and that's how you create programs that are sustainable, inclusive, and really represent the needs of the community. It's important to support rural communities because so often you have a history where so much of programs, whether it's like a private foundation or a government program, there's historically been so much attention to urban populations and urban areas. And so, the money, the resources, the staffing is all sort of urban focused, and rural communities legitimately feel overlooked. Their needs are not being represented, their voices aren't being heard, and there are countless examples of this. So in order to change this, it's incredibly important to have the voices of rural communities and the decision making, to have collaborative work that really brings together a lot of disparate voices. And this is how people will feel represented and included, and they feel like they are empowered to create programs that will actually be meaningful. I think this is really foundational to create trust within communities and across communities. In order to cross the urban-rural divide, you need to build relationships and trust, and that takes time and investment and a commitment.